I want you to talk about the different layers of the tissue that you were talking to me about.
Okay. So most people come in and they go, I lost volume in my face, or I don't like this fold, or I see my eyes are getting hollow. Well, those are specific anatomic changes that occur with aging in specific tissues. So the face goes from skin to fat to bone, but the fat is separated into different compartments. Some is above the muscle, some is below. It looks different. So unlike a filler where you can treat aesthetically and be the artiste, here you have to be both the artist as well as an anatomist, because we want to put the tissue that's being lost in these different compartments back into the compartments in a way that mimics or simulates the exact losses. It's almost like the reverse of a snowball, watching the face decay and then addressing the areas of decay by recycling your tissue actually changes that rate of decay and causes reversal.
That is so impressive. And another thing that you invented a device that helps with the fat and recreating it.
So when you take out fat, it comes out in a certain size based on the holes in the cannula or the metal device that's used to remove it through a little needle puncture. And then what we do is we have a little cube that we run it through, so we make 3 different products. Just like fillers, you don't put a clumpy filler under the eyelid, you put a very thin filler, and you don't put a thin filler deep in the cheek because you're using it for structure. So we do the same with fat. We make a more structural product for the deep areas under the muscle, a thinner product for the superficial fat, like in the forehead or in the hand, and then almost a cellular product in the eyelids, because the eyelids have no fat except deep in the orbit. What they have is, skin that becomes aged through sun damage and use. So we're regenerating tissue with these products.
Well, thank you so much
You're
for
very
sharing
welcome.
your very impressive technique, and I love it, and I hope that I will get to experience it at some point.
I think you'd be a wonderful candidate.
Aw. And speaking of candidates, who is a good candidate for this procedure?
Well, the reality is, and people may not want to hear it, but if you're coming in for more than one filler, you're coming in because you've lost volume. So the opportunity is to use more youthful tissue at that time to refill all areas. And in my opinion, that's the best candidates. Now, it's not to say that you don't use fillers, because fillers you use for the right reason to make you look more enhanced in given areas. Whereas this is really to put back the tissue you're losing as you age and to reverse you to a more youthful appearance.
Very interesting. And there you have it. And